Well, vaccinations are top of mind for many parents as kids get ready to head back to school. U.S. kindergarten vaccine exemptions are now at an all-time high. Look at these numbers. The CDC is reporting that the number of exemptions rose to 4.1% during the past school year, up from the previous 3.7%. Many parents saying they want school vaccination exemptions for non-medical reasons. Well, here to talk about vaccines and what American families should know about them is Dr. Joel Gator-Warsh. She's a doctor at Integrative Pediatrics and Medicine in Studio City. Great to see you, Dr. Warsh. Also, you're the author of a new book. It's called Between a Shot and a Hard Place. So great to see you. I want to start with the latest headlines. So we'll begin with this. The American Medical Association and American Academy of Pediatrics are now kicked out of CDC vaccine work groups. The Associated Press says that there was an email that was sent out on Thursday disinviting these committees from work groups. So what's your initial reaction to this decision?
Yeah, I just learned about it, and I think I don't know too much about it yet, so it's kind of hard to comment. I think that would be nice if we can all start to work together and start to come up with policy that isn't back and forth like we've been seeing lately, but I don't know all the back end of it, so I'm not too sure what to make of it yet at this point.
All right. Well, as far as vaccine hesitancy goes, we've got some stats in here that 1 in 4 parents are hesitant about vaccinating their child. So what information should they know about vaccine safety and vaccine requirements and whether they should be vaccinating their children?
Yeah, I think you made a great point that the vaccine hesitancy is increasing, and I think that's unfortunate. I think we need a lot more conversation and a lot more nuance, and I think that we have to be talking about the benefits and the risks of all procedures that we're doing. And we have lots of research on vaccines. We have a good understanding of the benefits. And with the increasing hesitancy, we're seeing some of these conditions come back and a little bit more cases this last year. So I think it's really important that parents understand that there is a lot of research and a lot of safety data, and hopefully we're going to continue to get more. But at the end of the day, I think we have a good understanding of how well the vaccines work and how much they can protect kids.
And where do you think the hesitancy comes from, this sharp increase? Is it post-COVID? Is it post the pandemic and mandates that were in place then? Is it RFK being HHS secretary and many people see him as somebody who's anti-vax, even though he says he isn't?
I think it's a lot of things. The hesitancy has been rising over the last decade or so, so it's not something that's new or specific to the new administration. I think that we've seen a lot of back and forth in this last year, and hopefully we'll see a little bit more communication and a little bit more discussion. But ultimately, I think with social media and with coronavirus, there is a lot more hesitancy because we went through a new vaccine. We saw a lot of back and forth messaging, and I think people are just frustrated with the entire establishment at this point with a lack of consistency and a lack of consensus. And so I hope that, again, we talk more, we have more conversations, we have more nuance, and we listen to parents, we listen to the concerns and start to get more of the safety data that parents are looking for. I think right now there's just a lot of, again, back and forth without a lot of listening.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.